Hello everyone, I'm Dr. Amulya from Child Health Pedia podcast and welcome to yet another episode. Today we have a very special doctor, Dr. Himabindu. She's a gynecologist, obstetrician and specialist in high-risk pregnancy. She has over 17 years of experience. She did her undergraduation in Andhra Medical College and then later moved to UK. And she did her post-graduation from Oxford University, UK. She has been awarded the National Excellence Award in 2019 for her excellent care in clinical work, and also she's been awarded and nominated for the Rehina Dawood Award in 2017 for her patient care. Thank you so much, Dr. Himabindu, for making it here today.
Thank you so much for having me. It's my pleasure.
Yeah. So she being an expert in high-risk pregnancy and obstetrician, let's talk to her regarding delivery, normal delivery and cesarean section. So pregnancy itself is a wonderful journey, but along with it comes questions, queries and uncertainty regarding the delivery process. So Dr. Himabindu, every mother's dream or wish is for a normal delivery. So what do you say, what are the chances of a mother to have a normal delivery?
Normal delivery is a very physiological process, and that is generally the most preferred mode of giving birth. This is because that's what the woman's body is designed for, whether it's the uterus, the pelvis, they're all designed to give birth to the baby. So it is definitely what we would advise for every single woman to try and aim for a normal delivery. If it is a woman's first baby and she's got no other medical conditions, she is well and her baby is well, her chance of having a normal delivery is in the region of 80 to 90%. If it is her second baby and she's had a previous normal delivery, the chances are in the region of 98 to 99%. Women who've had a previous cesarean section can also try for a normal delivery, provided they fulfill certain requirements. And in these women also, the chance of a normal delivery is in the order of 75%.
So that's huge.
Yes, absolutely.
So is there anything a mother can do to enhance her chances of having a normal delivery?
Yes, there's a lot of things that a woman can do to help her chances of having a normal delivery. And this should ideally start before the woman conceives. So pre-conception itself, it is advised that the woman should optimize her health. And this includes various things. So if she's on medications for any condition like diabetes, for high BP, for epilepsy, any condition at all, then it's important that she sees a doctor before she plans for a pregnancy so that her medical condition is optimized. She does not have a flare-up of the condition or exacerbation of the condition for at least 3 to 6 months before conception. She needs to be on medications which are safe for use during pregnancy. And once the woman conceives, it's very important that she has a well-balanced, a well-nourished diet. It's important that she stays active during labor. She needs to be exercising, go for regular walks, maybe do prenatal yoga, maybe do some even prenatal Pilates, aerobics. There are so many forms of exercises which are available, which are very safe to be done during pregnancy. And if she stays active during pregnancy, her chances of normal delivery are better. Along with this, managing her weight is very important. So ideally, the woman should optimize her weight and BMI before conception. But once she conceives and say that's the first time she comes to us, then it's important she follows the doctor's advice about how much weight gain is allowed in pregnancy. So for women who are starting the pregnancy already being overweight, we recommend them to not gain too much weight in pregnancy. But if a woman is starting the pregnancy being very underweight, then she is advised to put on a little bit more weight. So depending on their weight at the start of pregnancy, the weight gain would change. But at the end, they should make sure they attend all their doctor's appointments, make sure they attend all antenatal care, follow the doctor's advice, have a well-balanced diet, and remain active in pregnancy. And if they follow all of these basic precautions, generally the chance of having a normal delivery is pretty good.
So it means just going down to the basics of a healthy lifestyle, good diet, staying active. If a mother has any medical conditions, get it treated and be under continuous monitoring, consulting doctors. These are the basic steps just to enhance that a mother can have a smoother delivery process.
Yes, that's correct. Yes.
So now there's a lot of fear regarding the pain during normal delivery. They would have heard experiences from other parents, their own, even in their own family. And sometimes a mother can actually be really scared to go for a normal delivery just for the fear of pain. So what is your take on that?
So normal delivery and the contractions which are required for normal delivery unfortunately is painful. So that is the truth and that cannot be denied. But the perception of pain changes from woman to woman. Some women tolerate the pain much better than others. For example, if a woman is already suffering from very heavy painful periods, then labor generally is not perceived as too painful by her. But if the woman has not had any painful conditions and this is her first experience of pain, she would find it much more difficult to cope with. So it is very subjective. But again, the amount of pain and the nature of pain varies depending on the phase of labor. So in the early phase of labor, which is when the contractions can be still quite irregular and the cervix is in the early part of dilatation. So before labor, cervix is closed, and during labor is when it starts opening. And for the entire duration of labor, the cervix needs to open up to 10 centimeters. So the initial part of labor where the cervix is less than 4 centimeters, that's when the contractions can be quite irregular and the pain can be quite mild. Once they're in the active phase of labor and the cervix has crossed the 4 centimeter mark, then contractions are more regular. They come every 3 to 4 minutes apart and they can be perceived as quite painful. So things that a woman can do to help cope with the pain are again quite varied. We advise them to start with breathing exercises. This is something that they would be trained during pregnancy if they would have attended their exercise or prenatal yoga classes. And with that, most women cope through the early phase of labor quite well. Once they're in active labor, again, breathing exercises do help for a fair amount of them. Beyond that, things that would help are natural things like staying active in labor, walking around, using the birthing ball, and change of posture helps a lot with coping with pain. If they are not able to cope with these simple non-medical remedies, then there are medications that can be offered. And again, we would start with simple medications like tablets. Then we can move on to injections which are available. And there is also the option of Entonox, which is a gas that they can breathe through a mask which is given to them. And all of these do help with coping the pain. Beyond this, painless delivery is something that is quite in the news these days.
Right, because epidural or the painless delivery is something which parents are opting for as well.
Absolutely. So epidural is anesthesia, which is a local anesthesia given in the back of the woman. Just like how a woman would have a drip for fluids which is put into the hand, it is similarly a very thin plastic tube, almost as thin as hair, which is inserted in the back of the woman. The insertion process is not painful, doesn't take too long. And once the tube is inserted in the back, the medication runs through this. And this helps the woman to cope with the pain quite well, and it can last for as long as it's needed. So it does not impact on the outcome of the labor, because contractions will continue. Epidural does not impact on the contractions, and they'll be able to have a normal delivery. If for whatever reason the woman ends up with the emergency cesarean section, epidural is helpful even for that. They wouldn't need additional anesthesia for that.
So dear moms, like Dr. Himabindu has said, pain is very subjective. It can be mild, it could be severe. The initial phases of the labor could be mild degree of pain a mother can experience, but in later stages the pain can increase. There are non-medical ways to relieve pain, like Dr. Himabindu has rightly explained, breathing exercises, yoga, and then if that's not really helping a mother, then go to medical ways. You have certain medications which could be given, and then go for the epidural in case the pain is very severe. Now, how safe is this epidural?
So epidural is very, very safe, because most important thing that most women or couples are worried about is, are these safe for the pregnancy? Are they safe for the baby? None of the medications which are used either in pregnancy or during labor or for pain relief cross the placenta. So they do not go to the baby. They purely work within the mother's blood circulation. And so first is they're very safe for the baby. Second thing is, none of these medications have any long-term impact for the mother. They act for a very short time only during the actual required phase of labor. And whenever we need the medication to stop working, they do. So they can be absolutely titrated to work only for a few hours. So they're very safe and can be used without much worry at all.
So that's relieving for parents to know that epidural is quite safe and there's no harm. It has been proven that it's quite safe to be administered to the mother.
Yes. Yeah, there are lots of studies, and the risk is like less than 1 lakh for anything to go wrong.
Yeah. So another quick question, can a mother drink or eat during the labor process?
So it depends on the phase of labor the mother is in. During the early phase of labor, we advise the woman to eat well, to stay hydrated well, because that is how she's going to get the energy to cope with the contractions. But once she's in active labor, so beyond the 4 centimeters, and the contractions are coming very close and very regularly, then it becomes quite difficult for the woman to eat. And even if she eats, the chance of actually becoming sick and having vomitings is quite high. So during active labor, we advise the woman to not eat much, but stay hydrated with fluids. So these can be water, any kind of clear fluids like ORS or electrol, and that would give her adequate energy to cope with the labor.
So for some, the delivery process can be a breezy one, but for some, it can last longer. So is there any duration as such as to how much time a labor can last? It's a difficult question, I know, but approximately for mothers to be ready or informed in advance as to how much approximately the duration would be of the labor.
So again, this varies from person to person, and if it is first baby, the duration of labor is definitely longer than if it is a second baby or third baby. So like we discussed, the cervix has to open from 0 to 10 centimeters. So getting up to the 4 centimeters itself can take quite a long time for a first time mother. And that varies from a few hours, sometimes to a few days. And it can last for 3 to 4 days as well for some women, just to get to the 4 centimeters. If it is her second baby, that early phase of labor doesn't even last for half an hour to an hour. And once they come into the active phase of labor, getting from 4 centimeters to 10 centimeters, again, the expected rate of dilatation is at least half a centimeter to a centimeter per hour. So you're looking at a minimum of 6 hours going up to 12 hours. And if it's a second baby, generally the duration is much shorter, more in the region of 3 to 4 hours.
So sometimes, even though the mother has been in this process for a longer duration, there's something called as induction of labor, where medicines are administered to a mother to enhance or fasten the delivery process. So what is it all about?
So induction is basically where we have to give medications to the mother to either start the process of labor or to augment the process of labor that's already started. And it is done when we feel that continuing the pregnancy can be a risk to the mother or to the baby. And that can be for various conditions. So say we want to deliver a woman at 39 weeks. By then, if the woman has naturally gone into labor, well and good. But if she has not gone into labor, because continuation of the pregnancy would mean probably a poor outcome for the mother or the baby, we would offer induction. And depending on how far in labor the woman is already at the time, our process of induction would vary. There are various steps of induction, first of which would be, if the cervix is completely closed, we would give them medications to start, which can be tablets or it can be vaginal pessaries. And with these, the cervix softens a little bit and starts opening a little bit. If the cervix is already a little bit open, either naturally or with medicines, then we would break her waters, which is called artificial rupture of membranes. And once the waters are broken, for most women, contractions pick up. But if they still do not pick up, then we start a hormone drip, which is called the oxytocin or the syntocinon drip. And with the hormone drip, the contractions become quite regular, and that's when we achieve the contractions required, like one in every 3 minutes or every 4 minutes. So depending on the phase of the labor, depending on whether she's had a previous baby or not, whether it's her first baby, what we actually use for induction varies. It's very important to know that the outcome does not change whether the woman goes into labor naturally or with induction. So if a woman is healthy, her baby is healthy, her pelvis is adequate, and she would be having a normal delivery, that would not change whether she goes into labor naturally or with induction. And if it is not going to happen for whatever reason and she's going to end up with a cesarean, again, that would not change whether she labors naturally or with induction.
That's interesting. So we have seen instances where a mother is suddenly taken up to cesarean section after trying naturally for the normal delivery process. So what are the indications where a mother is taken into emergency cesarean section?
So as much as possible, we try for a woman to have a normal delivery, but there are certain indications why we need to do a cesarean section. Because at the end of the day, we need a healthy mother and a healthy baby. Right. So as long as both are healthy and labor is progressing, we wait. But if there are, say, reasons like the woman is contracting well, baby is also absolutely fine, but she's not dilating. So she's, say, 4 centimeters for more than 6 hours or 8 hours, that is not safe for the woman, because the contractions for such a long time without progress would cause risk to the mother, like she can end up with a lot of bleeding or various other complications. Then we would offer her a cesarean section. Similarly, if the baby is not coping, so when the woman is going through labor and the uterus is contracting, there is immense pressure on the baby with each contraction because the baby is squeezed. And with that, if a baby is well-grown, term baby, healthy baby, the baby can deal with it. But if the baby is either small, growth restricted, or there are any other medical conditions, or there is a cord around the neck or whatever, for these kind of conditions, when the baby has the pressure of the contractions, baby doesn't tolerate it and the heart rate starts dropping. So if the baby's heart rate is dropping persistently and consistently with every contraction, taking a long time to recover back to the normal baseline, then again, depending on how far the woman is in labor, we would offer a cesarean. So if this is happening at 4 centimeters or 5 centimeters, the baby is not going to tolerate labor for another 6 to 8 hours. But if this is happening at 9 centimeters or 10 centimeters, you know delivery will happen in half an hour to an hour. You know the baby can tolerate it. So depending on the condition of the baby or the mother, we offer them an emergency cesarean section as is best for their outcomes.
Right. So I guess there should not be any shame or guilt attached to this, because this decision would be taken keeping in mind the mother's health and what is best for the baby as well.
Absolutely. There is no shame in having a cesarean
because
section.
There's a lot of thing which goes on in society that, if you have a normal delivery, she's done a really good job. But then if a mother lands up in cesarean, she's always questioned about as to what she didn't take care of herself during pregnancy.
So what is important for the woman to understand is, at the end, she needs to be well and the baby needs to be well.
Right.
So yes, if she achieves a normal delivery, that's fantastic. But if she does not achieve a normal delivery for a medical reason, there is no reason to feel ashamed of it. Because there are certain medical conditions where we advise a cesarean section. For example, if the woman has very high blood pressure which is not controlled, or there are certain heart conditions where she's not allowed to labor, or say she's got large fibroids which are blocking the vaginal entrance and the baby cannot come down, or there is a placenta which is low, which is obstructing labor. There are various medical conditions for the mother for which a cesarean section is recommended, and she wouldn't be allowed to labor for her safety and her health, because she comes first. Only if she is well, baby is going to be well.
Right.
Similarly, for the baby has to be in a head down position. Baby should be able to tolerate the labor. If the baby is in any other position, like transverse position, then it's not going to be possible to have a vaginal delivery. So there are various reasons where cesarean may be indicated. And if that is indicated, it is necessary to do that for the safety of the mother and the baby. There is absolutely no shame in this, because at the end of the day, you have to do what is right for you and for your baby. And whichever way you deliver, you are still the mother of the baby. You will still breastfeed the baby. You will still look after the baby. And there is no difference in the bonding between the mother and the child.
So dear mothers, you heard it from the expert herself. There's no shame associated with the cesarean section. Every mother's pregnancy journey can be different, but the outcome is the same. So just enjoy the process, be it normal or cesarean, and enjoy the process, and then take care of the baby once the baby is delivered. So the post-delivery process, in case the mother delivers through a normal delivery, normal vaginal process, how long is the stay in the hospital, and what is the care she needs to take during the next 2-3 days?
So if she has a normal delivery which is completely uncomplicated, then the hospital stay is quite short, generally 12 to 24 hours. And during that phase, we train them how to look after themselves, how to manage their pain, how to handle the baby, how to feed the baby. And most women, especially if it's their first child, would have some form of vaginal tears and vaginal stitches. So we also tell them how to look after these tears, what medications to apply, when they need to actually seek medical help for herself or for the baby. And when she's confident in doing these, she would be sent home. If it is second baby, then women are generally quite confident in dealing with this, because I've done this before. So for them, the duration of stay is even shorter. Some of them even want to go home in 6 hours after delivery, which is absolutely fine.
So it varies. It's based on the mother's confidence, and if it's a second baby, obviously with the experience, the mother is more confident to go back home faster.
Yes.
So any last advice you want to give for parents from your side?
So the one thing I would tell the woman is, it's very important to look after your health. Right?
Prioritize your health.
Absolutely. Even before you plan a pregnancy, make sure you are healthy. And once you're pregnant, make sure you attend all the doctor's appointments. Take all the medicines that are prescribed to you. And if anything does not seem right, do not ignore it. So if you feel your baby is not moving well, don't assume it's going to be okay, because you're the only one who knows what your baby is doing. And if you feel your baby is not moving well, something does not seem right today, please see the doctor. Get medical help as soon as needed. Don't delay anything because work is more important, or because someone at home there is a guest or whatever. Your health comes first, your baby's health comes first. And if you do that, then I'm sure you'll have a good outcome in your pregnancy.
So it was wonderful to have you over here. You've told in such a simplified way regarding the various delivery process, the management during the delivery, medical, non-medical, and how to self-care during delivery and even after delivery. Thank you so much for taking time and making it today for today's podcast.
Thank you so much for having me.
Thank you.